Welcome to AMDA On-The-Hill, your periodic update on policy and advocacy for AMDA, the Society of Post-Acute and Long-Term Care Medicine. My name is Alex Bardakh. I'm the Director for Public Policy and Advocacy here at AMDA. I wanted to discuss a few things with you. First of all, recently the AMDA Board of Directors met and also went up to Capitol Hill to meet with their constituent representatives to discuss a few issues of importance to post-acute and long-term care. First, we discussed issues around elder care workforce development. There's legislation that's currently pending in Congress to reauthorize two different programs, the Geriatric Workforce Enhancement Program and the Geriatric Academic Career Awards, at a level that would be able to fund new programs around the country and refund the programs that are already active. For those of you that are familiar with the GWEPs and the GACAs, these programs provide one of the only opportunities to train clinicians in geriatrics around the country. We got very good reception from Capitol Hill and got a lot of interest to co-sponsoring the legislation, and even had a lot of follow-up about new legislation and new ideas for enhancing geriatric workforce around the country. We also addressed the issue of expanding telemedicine. This has been an issue that I've discussed in previous policy updates, and I wanted to talk about it again really quickly. We've spoken with, on Capitol Hill about an administrative regulation out there that restricts the use of telemedicine for the skilled nursing facility subsequent care codes to once a month. This restriction, we feel, stifles innovation in this area and does not provide enough incentive to use telemedicine to prevent readmissions and other positive outcomes that have been shown in literature. We have made a number of comments to CMS, and now we were asking members of Congress to reach out to CMS to urge them to change this policy. Once again, we got very good reception from members of Congress who are looking at this issue, and hopefully we will be able to make some headway. Finally, the third issue is another one you've probably heard about if you've been listening to these policy updates, and that is the issue of keeping track of of the names of medical directors in a medical director registry. If you've listened to these policy updates before, you may have, you know that this is an issue that we've addressed because we feel that it is important to know what the arrangements between skilled nursing facilities and these medical directors are. There are certainly very engaged medical directors around the country that are very active in the facilities and are working hard to improve patient care, but we do know from reports from the Office of Inspector General, Department of Justice, there are simply contracts that are basically referral loops and other things. We feel like having a directory of medical directors will provide transparency into how many facilities these medical directors practice at and what level of engagement they may have. Secondly, it provides transparency for consumers looking for choices as they put their loved one in these facilities. They need to know who the clinical leaders of these facilities are, and they need to be able to reach out to them. So we feel like having a publicly available, publicly reported medical director registry is something CMS can do within its authority and should do to improve care in these facilities and provide transparency to the consumers. As you know, Congress is now back in session. They were in an August recess. So hopefully with discussion of these issues we can get some movement. But some of the bigger topics, of course, they will be addressing deal with surprise billing, drug pricing, and other healthcare related issues. So this promises to be a busy fall season. Of course, Congress does not end. The congressional term does not end this year because it's not an election year, and it will roll over into the new year. So we are looking to actively participate in the process. On the administrative side of the ledger with CMS, we are addressing issues that were I talked about in the last update in the physician fee schedule proposed rule. And if looking at what's coming up next is we'll be looking at what CMS will do with the comments that are submitted, and hopefully they will release the final rule in early November. And of course we'll provide an analysis of that rule after that date. Finally, just another reminder that the patient-driven payment model for skilled nursing facilities, which replaces the long-standing prospective payment system, is going to take place is going into effect on October 1st. AMDA has a number of resources. If you still have not availed yourself of those resources, I certainly strongly urge you to take a look at the articles, the webinars, and the resources that we have provided. And there are links that are going to be below this, the video and the podcast. So please avail yourself of those resources, and please feel free to reach out if you have any questions. We will be providing even more webinars in the future. We are collaborating with other organizations, with facility-based organizations, to provide an even more complete picture of what PDPM will look like, and we are hoping to have a series of webinars as PDPM is rolled out, understanding that this is an enormous change for skilled nursing facilities and the clinicians that practice there. That's all I have for today. Again, as always, please feel free to reach out if you have any questions, if you would like to get involved. And I hope you're reading our resources, listening to these updates, and staying involved. Thank you very much.